Hello, I'm Jason, a psychologist at the Child Protection Unit of Philippine General Hospital. My part will be on Module 2, which is about the foundations of trauma-informed care. As we've spent time discussing trauma and its impact on survivors, it is important to discuss the hope of recovery and healing from trauma, as well as the role service providers like you or like us play in this process. This module will focus on the principles of trauma-informed care, how service providers can create a trauma-informed relationship with survivors that will help in facilitating the recovery and healing. And also for you to think about your own perceptions and attitudes as they greatly influence the manner in which the service providers like you approach relationships with survivors. In session 2.1, we will talk about the principles of trauma-informed care. In session 2.2, we will talk about recognizing triggers. And the last part of this module is session 2.3. We will discuss about resiliency and relationship. This module's main objectives are for the participants to be able to articulate the principles of trauma-informed care. Second, for the participants to be able to describe resiliency and how healthy relationships can foster healing for survivors of trauma. Now let's begin with the principles of trauma-informed care. Trauma-informed care refers to how an organization or service providers think about and respond to survivors of trauma. It encompasses an understanding of the prevalence of trauma, its impact on survivors, and the complex path to recovery. Because trauma is so pervasive, having a basic understanding of what trauma is and how it impacts those who have experienced it is an important part of our work as service providers. When we lack a thorough understanding, we risk misinterpreting behaviors or reacting unhelpfully to our survivors. And in some cases, de-traumatizing them. This can happen in centers that provide shelter to survivors of trauma, as well as in the community-based care settings. Now, let's just have a very short reflection. Can you think of any example when someone has misinterpreted your behavior or actions and responded unhelpfully because they lack a full understanding of your experience? Or a time when you have misinterpreted someone else's behavior and responded unhelpfully? Now, let's have this example. Suppose it is the first year death anniversary of your grandmother. Perhaps you feel sad and just need some time alone. But you couldn't take that day off to your work. A colleague asked you to go to lunch and you decline without explaining. Now, your colleague will begin to worry that you are mad at her and would also wonder what she did wrong. But in reality, you were not upset with her at all, right? Rather, just needed some time alone. Some of us, or some of you, may have similar experience to that of this example, with perhaps with our colleagues or in our respective communities. When we talk about trauma-informed care, we are not talking about clinical intervention like a specialized therapy or counseling. Okay? We are talking about the way we engage with survivors on a daily basis. At its core, trauma-informed care seeks to avoid re-traumatization and support survivors' recovery through creating a physically, psychologically, and emotionally safe spaces. Being trauma-informed actually breeds a number of benefits, such as, for example, it improves service providers' ability to communicate with the survivor. Some of us may be anxious for the first time whenever we have that time talking to our first client. It also improves survivors' behaviors and attitudes. It ensures that survivors receive the help that they need, receive the appropriate help that they need. It also reduces the service provider's likelihood of experiencing vicarious trauma or burnout. This is very important because as a service provider, remember that ourselves, yourself, is your main tool. And that includes your actions, your behaviors, your listening skills, and so on. It may have a very big impact to your survivors or to your clients. There are 6 principles of trauma-informed care that we'll be discussing. First is safety. Staff, survivors, and anyone engaging in the organization should feel safe, both physically and psychologically. The setting is such that it is appropriately private and conducive to healing. As much as possible, noises, distractions, or triggers shouldn't be there. The next principle is trustworthiness. Trustworthiness refers on how decisions in the shelter or in your organizations are being made with the goal of building trust with survivors and others engaging with the organization. Remember that mistrust is common to someone who experienced trauma. Nawawala yung trust. Thus, it is important that we make sure that the organization is a safe place, not just a safe place, but a safe place with trustworthy people and staff. The next principle is peer specialist. These are survivors who have lived the experience. They are recognized as potential supports for others in their journey towards recovery. Peer support is encouraged and facilitated as a means of promoting recovery and healing. The next principle is collaboration and mutuality. Here, the organization recognizes that everyone working in the shelter or perhaps in other organization has a role to play in trauma recovery. That one does not need to be a therapist, not to be therapeutic. It can be a house parent. It can be a security officer. It can be a safety officer, a social worker, or an admin staff. Next is empowerment, voice, and choice. Individual strengths and experience are recognized and celebrated in the journey towards recovery. Remember that. Survivors are given a voice in matters that impact them, and choices are offered whenever it is possible. Building a strong sense of self, built on strengths while developing new skills. It's important to give them choices because remember, some of them were not given that control. They were forced, they were coerced during the incident. So we need to provide that to them. Okay? We need to provide that so that they can have that strong self to develop new skills that will help them cope every day. The last principle is cultural, historical, and gender issues. The respect for diversity. Service providers actively dismiss stereotypes and biases based on race, sexual orientation, ethnicity, age, home of origin, and other such factors. Recognizing the value of each survivor's unique history and traditions. Okay? When we have a trauma lens, we are also lowering down our prejudices. Now, to sum it up here, the key learning points in this part of the module are the following. We learned that number one, trauma-informed care refers to how organizations and service providers think about and respond to survivors of trauma. Second, we also learned that there are multiple benefits of being trauma-informed for both survivors and service providers like us. And third, we learned that service providers need to consider the 6 principles of trauma-informed care in dealing with survivors.